Good news! Breast cancer is curable. The number one question that runs in the minds of breast cancer patients is, do I really have to undergo mastectomy? Can I avoid it? I will discuss more on breast cancer on May 13, Thursday, 7:30 p.m. Stay tuned.
Hello everybody, welcome to another episode of Simply Heal. Today we're going to talk about breast cancer again. This is a very hot topic, and the last time Dr. Jansen spoke about it, and there were so many questions from the viewers. We got Dr. Jansen back to talk to us about breast cancer again today. So welcome, Dr. Jansen.
Yeah, glad to be here again. Excited to be discussing again with you.
Yeah, I saw the trailer for today's program, and you made such a strong declaration that I'm sure all the viewers out there are so excited to know more. You said that, I saw it in the trailer, you said, breast cancer is curable. Wow, that is such a powerful statement. Would you like to elaborate on that? Because I'm sure that gave a lot of hope to all our viewers out there today.
Okay, so yes, breast cancer is curable, especially when it is discovered in the early stages. But even so, when it is discovered during the advanced stages, there are a number of patients can still survive, okay, or have a good survival rate, okay? So first, let's discuss the early stages. What criteria must be met for you to be able to survive breast cancer? Okay, so number one, it shouldn't have spread to other parts of the body, okay? Because if it spreads, then it is more difficult to control. So if it's just localized in your breast, have it removed, okay? Do not be afraid of surgery. Breast cancer surgery nowadays is very safe. You won't lose a lot of blood, okay? Number two, you have to change your risk factors, okay? The number one contributing factor to breast cancer development is lifestyle, okay? Your diet, your physical activity, your stress levels, your sleep. So all of those things put together can contribute to breast cancer or actually prevent you from getting breast cancer. And even if you already have breast cancer, lifestyle can actually reduce the size of tumors, okay? It can alter your genes and actually induce apoptosis to the breast cancer cells. Number three, okay, you have to take action. You have to listen to your oncologists, okay? When the oncologist advises you to go for chemotherapy, please do not be afraid. Now, yes, chemotherapy, if you are afraid of getting chemotherapy, yes, it is valid because there are a lot of patients who get really bad side effects. But the chemotherapy protocols nowadays actually have reduced the side effects significantly already. Okay, I have one patient, breast cancer, stage 4.
Stage 4
bone
breast
metastasis.
Cancer. Wow. Bone metastasis.
Bone
That's
metastasis,
difficult.
yes.
Very difficult.
Yeah. If your breast cancer metastasizes to the bone, that is painful.
Yes, the bone cancer is very painful.
Yeah,
guys.
but you know, this patient of mine can go shopping for at least 30 minutes, a walk for at least 30 minutes. Imagine, walk for at least 30 minutes.
Shopping.
Go shopping. Some patients can't even rise from their bed, So, I mean...
What's this patient taking? How come she is doing so well for breast cancer?
Well, at first, she was reluctant to go for chemotherapy.
Okay.
So I tried to convince her. Back then, when I first saw her, she was just in her first cycle of chemotherapy and the side effects were so bad. So I told her straight, you have to go for the chemotherapy. You have to finish it.
So she had very bad side effects for the first cycle. Yeah.
Her appetite was down. Her weight was down. She was fatigued, really fatigued. Okay, but you know, that was one time, and then she stopped. Then we had a conversation. So she is currently now on her 5th cycle of chemotherapy.
Wow.
She had her left breast removed already. So her right breast is still there. 4 tumors on her right breast.
Wow.
2 of them were gone.
Wow.
There's just 2 more small tumors left.
Wow.
Okay, so now her oncologist is actually thinking to go for radiation therapy because it's just too
small tumors.
So it's not gonna be worth it to just...
Is she on PPARs?
Yeah, she's on PPARs. I'm going to go there next. Okay.
Wow.
Hi guys. Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. So the next plan for her would be radiation therapy. But I told her we have to be very, you have to consult, of course, with her radiation oncologist, but we have to be also careful because radiation therapy is a localized treatment. So if you have other
Tumors anywhere else,
it's gonna be futile.
Yeah,
so
not treated, right?
yeah.
Being ignored.
The risk and benefit has to be weighed properly. Okay. And then the next thing is the exciting part is how come she didn't have these side effects? Oh, by the way, she didn't lost her hair.
Wow! Stage 4 cancer, go for 5 cycles of chemo,
yeah.
no hair loss.
No hair loss.
I think because breast cancer, I'm so excited. You can see how excited I am. Because breast cancer is, of course, we always think it's women. And I think, and my wife is a lady, so I can tell you one thing. Whenever hair drops from a lady's head, they are so concerned. It's your... Ladies, I understand, all right? Because I'm a married man. Your hair is your crown of glory.
Yeah.
So I think that is amazing. No hair loss.
Yeah, I was really amazed as well. So, the chemotherapy protocol nowadays, it's not as what it was before. Okay, so you have to trust your onco, take courage into taking it. Now, what is the key thing here?
What's the key thing?
And by the way, her appetite is also up.
Wow.
Despite taking chemotherapy.
Wow.
She actually gained weight during chemotherapy.
Wow.
She gained 3 kilos. Before I first met her, 44 kilos, now 47 kilos.
Wow.
Okay, so that is...
So what's the key?
The key thing here is you have to follow the prescription of your doctor. You have to change your lifestyle. Okay? And another thing is SimplyNaturePPARs. That is also what helped her. Because SimplyNaturePPARs actually decreases the side effects of chemotherapy. It preserves the bone marrow integrity. It also preserves your immune system and make your immune system more hostile to these breast cancer cells. Okay?
Wow. I just did a talk with a group of doctors, and half the talk was on how SimplyNature liquid protects your body from the side effects of chemotherapy. Which is why you will notice, right? We are called Simply Healed. So most people think that when they listen to our program, we will tell them don't take chemotherapy.
Yeah.
And there will be a lot of our viewers will be kind of surprised. But you know why me and Dr. Jansen, we are not afraid of chemotherapy? Because we know how to keep your hair during chemotherapy. We know how to keep your appetite.
Right.
That's why we are both more focused on what the chemotherapy can do for you rather than the harm. Because with SimplyNature Liquid, we have found a way to remove the harm so that you get more of the benefit and very little of the harm. Yeah. And that means that your chance of success in cancer is much higher. And
Yes.
that's what, as a doctor, Dr. Jansen always wants. And for me, my dad is a 2-time cancer survivor, so that's also what's in our hearts. So, wow, very exciting. Thank you, Doc.
Yeah.
You mentioned the thing, which is the topic. I saw in your trailer for this program also. You were going to share with us whether to get a mastectomy or not.
Yeah.
So you just said have the tumor removed. Okay. First of all, Doc, when we hear have the tumor removed, does it mean that every time we remove a breast tumor, the whole breast is gone or something like that?
No, it depends on the staging. And actually, it depends on the surgeon who's taking care of you. Because, as you all know, every doctor has their idiosyncrasies.
Okay, every doctor has a different opinion.
Every doctor has a different opinion when we manage our patients. No? So, but strictly speaking, the indication for mastectomy is when the tumor is still localized and it is small enough to be removed. And another thing is that there should be no spread to the lymph nodes. Okay? So, when there's no spread to the lymph nodes, and then the tumor is less than 2 centimeters, then you can have actually a lumpectomy.
What's a lumpectomy?
A lumpectomy is just removing the tumor without removing the breast.
Oh, so you don't need to cut out the whole breast.
Yeah. Then afterwards, if the biopsy or the histopathology of the tumor is, for example, malignant, and it hasn't penetrated the basement membrane or the capsule, capsule, right? So you just have to undergo radiation therapy. Then for a month, then that's it. Then monitor the subsequent months for any recurrence or side effects of radiation. Yeah. Hi everyone, thank you for joining us today. If you want to have a consultation with me, just comment down below and our team will get back to you to set an appointment with me.
So I hope our listeners hear the very important key message here is that don't wait, right? If you feel a lump, it's still small. So if you act immediately, give Dr. Jansen a call, or you give your doctor a call and you make a quick diagnosis, then you don't need to remove your whole breast. You can do a
Lumpectomy.
lumpectomy, right? You can just remove that portion because you caught it early. So again, don't wait, don't procrastinate, don't say wait till next week, or that maybe it's not a lump, don't say all those things. If you feel something, if you suspect anything, take action immediately, because that will save your breast.
Yes. And that will also save your life.
Your life. Hallelujah.
Yes, okay. Because I've had a family member as well who didn't well, she knows that there's something that's growing on her breast, but she didn't actually went for a consultation. She just had it there, didn't tell us about it. You can just imagine. So the only time that we knew that she had breast cancer was that when she had numbness on her face, she wasn't able to walk.
Oh my.
And we brought her to the hospital. The initial diagnosis was stroke. Yeah, because
she couldn't walk.
she couldn't walk, numb. She couldn't speak well. She has slurring of speech. So those things the initial thing that you would think of is stroke. Yeah. So when she was admitted, had an MRI scan, lo and behold, it was stage 4 breast cancer.
Wow.
Okay? And the sad part there is knowing breast cancer is curable. When she had that lump initially,
that's
had she
sayang.
removed it immediately,
Very sayang.
she would be still with us here now.
So I keep hearing this statement coming from Dr. Jansen, and I want everyone to remember it. Breast cancer is curable when it's detected early. So take action immediately. And I learned a new thing. I knew what mastectomy is, which is to remove the whole breast.
The whole breast.
Today I learned a new term.
Lumpectomy. It's a lump.
Okay, lumpectomy.
Yeah.
So girls, don't worry. And Doc, I just want to ask, even if you do have a mastectomy, is there a solution for ladies? I mean, that's a big part of the identification, right?
Yeah.
To have breast.
Absolutely.
So reconstructive surgery, how is that today? I have no idea.
Oh, they do it well. Well, I'm not a plastic surgeon, but they insert the silicone to mimic the breast.
So basically, unless the person examines very closely, you will basically look like you didn't have a mastectomy.
Yeah, absolutely.
Okay, so I think that answers all the important questions. I was very encouraged. I didn't expect that stage 4 breast cancer testimony. That's really amazing. Stage 4.
Stage 4, yeah.
Metastasized to the bone.
Yeah.
To the viewers out there, especially those of you who are not so familiar with cancer, once it goes to the bones, it's very painful, it's very difficult to treat. But yet the patient is doing well.
Yeah.
Yeah.
I was personally amazed as well.
Yeah, so our SimplyNature Liquid PPARs is really pretty amazing.
Yeah.
It really is.
That is the one that I prescribed her during the chemotherapy sessions. SimplyNature Liquid PPARs.
Wow. Okay, so Doc, maybe a few more simple questions so that we can go Q&A, because I can see the questions popping out already. One is this. Even if we feel no lumps, should we ever go for mammogram, or how often should a lady, because now it's so important, right? We know that we find out early, breast cancer is curable.
Yep.
You can do a lumpectomy instead of a mastectomy.
Yep.
So detecting it early is very important. First question, is it very likely that almost every woman at some point or another might contract breast cancer? I mean, is that something now that is so common? Is it like 50% of the women will get breast cancer at some point of their life, or is it a lower percentage?
I can't really tell the exact percentage, but of course, if you have breast, if you're a woman, there's that risk for you to develop breast cancer sometime later on in your life. If it's not in your 40s or 50s, probably it will occur in your 60s or 70s. When the more we age, the higher the risk is for us to develop breast cancer.
So women need to, how often should a woman check themselves or do they need to go for a mammogram every year, or what would you recommend for a person, since detecting it early is so important?
Hi guys! Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. For breast cancer screening, if you do not have any family history of cancer, 45 years old, you do an annual breast ultrasound and an annual mammogram. Okay? So that is the basic. But if you have someone in your family who also have breast cancer, then at 40 years old, you have to start it already. Okay?
And then you do it every year or what?
Do it every year.
Every year.
Once a lump is discovered, then that's the time that the monitoring is changed. Okay, so if you have a lump in your breast that you are able to palpate, breast ultrasound should be done twice a year, every 6 months. Okay, if it's benign, okay.
Okay.
For the mammogram, it should be annual mammogram.
How much is a mammogram?
A mammogram, probably it's a basic X-ray. It depends on the hospital or on where you want to do it, but it probably costs around 5 to 10,000.
Okay, 5 to 10,000 is definitely manageable.
Yep.
If that is tough for you, I think at least do it biannually, because I think most women don't even do it at all.
Yeah.
My wife is 45 and I don't remember her ever going for a mammogram. But then again, she takes lots of SimplyNaturePPARs. All right. But I also heard, Doc, that, I've read articles, if you do a lot of mammograms, it actually increases your risk of developing breast cancer, because that's also radiation.
Yeah.
Yeah. So can I advise, is my advice correct? Because every time for myself, every time I go for x-rays, MRI is okay because it's magnetic resonance. But if I go for any radiation thing, after that I'll be popping lots of SimplyNaturePPAR tablets, and sometimes I might even break out the liquid, just one vial. The reason is because I was actually inspired by Iron Man. I don't know whether you guys watch Iron Man 2. Tony Stark was suffering from radiation sickness because of the thing he had in his chest. And I don't know whether you guys noticed it. He was always drinking from this water bottle, green gook. Okay, and the reason is because microalgae are actually scrubbers. They actually absorb radiation. They actually scrub heavy metals from your system. So every time I go for an X-ray, I take extra tablets for the next few days, just so that my system removes whatever little radiation there is. It gets detoxed out as quickly as possible. Is that a good recommendation?
Well, yeah.
And also chlorophyll, very high in chlorophyll, very good for detoxing.
Microalgae is food, so I mean, it's just you eating the stuff, right? So there's no harm in
so
it.
Go for your mammogram, buy one bottle of PPAR tablets the week that you are doing mammogram, just eat more of it. Because just be safe.
Yeah.
Right?
But if radiation exposure is a concern for you, the mammogram schedule of once a year is the safe.
It's safe.
It's the safe amount of mammogram that you can receive. So it's the best of both worlds.
Okay.
It's when you get the best benefit
with
the lowest risk. Yeah. And what's more important is the food that you eat, because that has a lot more influence in you increasing your risk or decreasing your risk for breast cancer.
All right, Doc, I think you've answered the key 2 things you promised in your trailer. Breast cancer is curable. Early stages, stage 1, and maybe even stage 2, is so curable. Your chance of success is so high. And thank you for sharing with us a patient who is stage 4. It's like the worst for the viewers out there, it's like really the worst combination to be stage 4 and metastasized to the bone. And Dr. Jansen shared that the patient went for chemotherapy. And again, it's not a rosy story. The first cycle was very terrible for the patient.
Terrible.
She wanted to give up. Dr. Jansen persuaded her, stay on course, right? And she went on was it the liquid or the powder?
It was the liquid.
Oh, she went on the liquid. And then after that, no hair loss after 5 cycles of chemotherapy. And shopping for 30 minutes, even though she has cancer metastasized to the bone. Wow.
The thing that I'm more concerned for is getting COVID. You know?
Okay. And her tumors have been reduced, right?
Yeah, tumors have been reduced, definitely.
Wow. So she is in a good position to recover, even though stage 4 metastasized to the bone. I think with that, I just want to stop there, Doc, because I think that is the most encouraging thing. If that can happen for a patient, I'm sure your condition can be cured, all right?
Hi everyone, thank you for joining us today. If you want to have a consultation with me, just comment down below and our team will get back to you to set an appointment with me.
Okay, Doc, let's go to Q&A. But before we go into live Q&A, okay, these are some questions from a previous program. So again, if we don't answer your questions today, tune into our next program because we keep the questions and we will answer them again, all right? Okay, this one said, is biopsy for a metastasized breast cancer needed if you decided to go natural?
Okay, here's a number of things here, no? Okay, if you know you have metastatic breast cancer, then that would have been biopsied already.
So you don't need another biopsy.
Yeah, you don't need another biopsy in the first place. Or if a biopsy wasn't done, your breast would have been removed, and then the pathologist would have discovered, yeah, this is a breast cancer that we're looking at. Your imaging is consistent with metastasis, so okay, so there you go, right? Biopsy is only needed if you are going for oral chemo. Okay, because there are certain types of breast cancers like PR positive, triple negative, triple positive, HER2 positive. So each of those types of breast cancer has a specific oral chemo drug for each of them. Okay, so that is the time when you need the biopsy. Okay, or a biopsy is also needed if your doctor is suspecting for a malignancy, or if the scan is actually equivocal. Meaning, the result of the scan can be malignant or can be benign, and the biopsy is needed. So that's the time that you need the biopsy. Okay? But if you are going to go natural 100%, then you don't need the biopsy. Because the purpose of the biopsy is to know what type of oral chemo drug the doctor will give to you. Okay?
Oh, so if you know you already have cancer and you want to go natural, no need to do any more biopsy.
Yeah, because that wouldn't make sense, right?
The biopsy is only for the oncologist to select what chemo drugs to give you. All right. Okay, so there you have it. A clear answer. Doc, this one is in Tagalog, so I don't completely understand, but I'll read the part in English. Okay, we had our grandmother that has breast cancer and she died already. Could there be a possibility po na I don't know how to read the rest?
Okay, I'll read it for you guys.
Okay.
We had our grandmother that has breast cancer and she died already. Could there be a possibility po na magka-breast cancer din po ang kanyang mga anak na babae and we, her grandchildren, as well? Thank you po. Yes, breast cancer is hereditary. Okay? You can inherit the genes from your grandparents. And let me share with you a very important thing with our lifestyle, no? Hi guys! Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. Our lifestyle can actually dictate our gene expression. Whether a gene gets expressed or not depends entirely in the environment we live in.
Wait, Doc, just to interrupt, because you use quite a technical term, genes being expressed. Can I use a more layman language, which means whether you switch on the genes that cause you to have cancer, right? Whether it's switch on or switch off.
Yeah. Okay. So that's a more simpler way to put it. Okay. So our genes, no, when you get pregnant, our genes, we pass it on to the next generation, to the fetus, right?
Yeah.
Okay, so everybody knows that. Now, the egg cells of the fetus, if it's a female, the egg cells of the fetus is developed when it is just inside the womb. The influence of the lifestyle or the genes of the mother is very influential on the genes of her grandchildren.
Okay.
Because the ovum of her baby or the egg cells of her baby is already being developed when the baby is still inside the womb.
Okay. So if your grandmother has cancer genes and your mother's lifestyle could activate the cancer genes, because while the egg which you come from is being created, is what your mother ate that affected the egg that became you.
Yeah.
Wow.
It's actually what your grandmother ate
Okay.
or how
Wow.
your grandmother lived. So that's
Wow.
how influential it is. But our genes do not dictate our destiny.
Wow, I love that.
Okay? Because genes can be turned on and turned off. Okay? Breast cancer genes can be suppressed depending on the lifestyle that you are living.
So if you want to know whether your lifestyle puts you at risk for breast cancer, that we can't answer in a general Q&A. Make an appointment with Dr. Jansen.
Yeah.
I think that's really important. That's really important if cancer runs in your family. So just have a quick chat with Dr. Jansen, 15-20 minutes. You know, tell him the things that you love to eat, and he'll let you know whether that's putting you on a path to breast cancer or not, and what are the things that you can do to make sure that your breast cancer genes that's in your family is switched off so that you never develop breast cancer. I think, Doc, that is all for the previous questions, and we would like, Doc, shall we move to the live Q&A tonight?
Sure.
All right, so thank you. We will now move to our live Q&A. Thank you, everyone, and do tune in and please share this video. All right, before we go Q&A, please share this video with other friends and loved ones. I think this topic is so meaningful to all the ladies in our lives, so please share. All right, thank you, Dr. Jansen. Let's go to our Q&A.
Right. See you at Q&A.